Hello, my name is Megan Duden, and this is my Educated Citizen presentation. So my public issue that I chose is human trafficking. Human trafficking is considered the act of receiving, keeping, moving, or gathering of a person by use of force, threat, deception, or coercion. Human trafficking today is considered the modern-day form of slavery. According to a 2017 report from the International Labor Organization, it is estimated that there are currently 24.9 million victims being trafficked. 17% of those are estimated to be sexually exploited, and 64% are exploited for labor. It is suspected that 15.4 million victims are 18 years or older, while it is estimated that 5.5 million victims are under the age of 18. 71% of victims are women and young girls, while the remaining 29% are men and young boys. The two races with the highest percentage of victims are Asia Pacific at 62% and African at 23%. Europe and Central Asia make up 9% and Americans make up 5% of the trafficked population. So why did I choose this public issue? So I chose to research and discuss human trafficking because it is becoming an increasing problem, not only in the world, but even in Nebraska. There have been cases of trafficking identified in all 50 states. 88% of trafficking survivors said that they came in contact with a healthcare worker during their time being trafficked. Because I will be a future healthcare worker, it is important for me to understand the severity of the problem and how to be a solution to this problem by being able to identify and stop it. I also aim to eventually become a SANE nurse, which this will be even more prominent in that field of work. So health conditions that victims are subjected to include sexually transmitted diseases, HIV, AIDS, pelvic pain, rectal trauma, urinary issues, mutilation, pregnancies, infections, untreated diseases, substance abuse problems and addiction, depression, shock, psychological trauma, and so much more. So, in order to have the tools to identify and correct human trafficking, one must be an effective communicator, reflective individual, and a change agent. The remaining of this presentation will discuss a variety of clinical situations I have experienced during my time at Nebraska Methodist and how they aided me in becoming an effective communicator, reflective individual, and a change agent. I will then relate my experiences to how they can help me in regards to human trafficking. So to start off, I was assigned a patient who had just had surgery on her cervical spine due to a spinal cord injury. When I asked her about the injury, she told me she had been losing feeling in her hands to the point where she couldn't even write for years. She went to doctor after doctor who told her it was just her rheumatoid arthritis. Finally, she met a doctor who listened and did imaging on her neck. They found spinal cord damage and she went to surgery. She had weakness then resulting in her legs and she was left in a wheelchair. Yet, with all this trauma and struggle, she was such a pleasant and understanding woman. A situation that could make anyone cynical to healthcare, she maintained a positive attitude. So, through this experience, I learned that in order to be the best nurse possible, you need to treat the whole patient and take into account mental and social well being, not just the physical symptoms of a disease or ailment. In order to be a critical thinker, you must analyze perspectives of holism. Mental health plays an important role in a patient's recovery. I also learned through this experience that you need to trust what your patient says and feels. It is their body, they know what's going on. This patient was discredited by doctor after doctor until finally one believed her and that it just wasn't her rheumatoid arthritis. So it is important to listen to your patient. So, what I learned from this experience that can be applied to my public issue is that it is important to assess the whole patient, physical and mental, reflecting on the needs of the patient, both visible and invisible. It is important to help provide resources for counseling. I also learned to trust your victims and what they say and believe it. It is important to build that trusting relationship in order to get them the help that they need. So, my second experience to become a reflective individual. This patient was the first one that I've ever had who had dementia and was described as being a peach who could turn on a dime. She was in the hospital after a fall that fractured her left arm. She was only oriented to self and had been combative towards other staff. I looked at her medication list and saw that she had melatonin due at 8, noon, and 6, and the order stated that the melatonin must be taken with Bisprone. My knowledge of melatonin was that it aided in sleep, and I was confused as to why my dementia patient was taking it 3 times a day, and it needed to be accompanied with Visprone, an anxiolytic. I was left wondering why. So I learned through this experience that as a future nurse, it is important to continuously engage in learning. Going through this program, I have learned that many things, such as techniques and medications, have a labeled use and then many other uses as well. I found an article that found that buspirone used with melatonin reduces oxidative damage and anxiety-like behavior. Oxidative damage has been linked to dementia, so this is why my patient was taking it. It is important that if you do not know something or have some questions, to find out. As a nurse, it is important to commit to continuing education. My tie back. I will use what I have learned through this experience to help me in my public issue of human trafficking. It is important to educate yourself to spot the signs of trafficking and know how to report it. It is important to get this education because, as I said before, many healthcare workers come in contact with trafficking victims. So, as an effective communicator, so what happened during this clinical experience? So an effective communicator first is able to use situational, oral, and nonverbal context cues to generate and organize ideas in a concise manner. So it's important to be an effective communicator in the clinical setting because there can be a lot going on, making it easy to lose effective communication, leading to important information being lost in the commotion. So a clinical experience that sticks out to me as a time where I was effective communicator was in the ICU this semester. It was the first time I had a patient the entire week, so I got to know the patient and his family. The patient was in septic shock and on CRT. He had a history of drug and alcohol use, resulting in his body being too weak to recover. His ABGs were falling into more acidic ranges, and his lactic acid was at 22. His potassium rose to 6, and he began to have heart arrhythmias. He was declining fast, and doctors and nurses began to have the difficult conversations with each other and with the patient's family. The patient ended up dying on my last day. This experience will help me. So what I learned through this experience is that it's important to communicate in a concise and accurate manner and report important information to the oncoming shift. You must filter out the less important information and ensure that the main pertinent information is given to the correct person. Through this patient, we were a revolving door of different specialties and different people coming in. I noticed that communication was lacking between these specialties, and they used the nurse and me as a focal and center point for communication. And my nurse would get information from one specialty and have to communicate that to another. So it is important to know what you are talking about to get that information out. So this experience will help me address my public issue of human trafficking because communications between different departments is key to helping the victim. As I had mentioned previously, trafficking victims can have many different health ailments, requiring many different specialties to look after them. So it's important that all the departments communicate effectively to give them the best care that they need. My second situation. So once getting to the floor, I received my assignment and I headed to the room to hear a report. The night shift nurse reported to us important information about the patient. He was DNR, what his allergies were. He had a stroke that resulted in left-sided paralysis, and he was very hard of hearing, and he was upset, and he kept saying he wanted to die. I asked what medications he received, and I was told he had been refusing any and all medications. As the night shift nurse left, he wished us good luck with what he defined as a difficult patient. My first interaction with this patient was when I saw the blue light pop up above the door, indicating that the patient needed something. Upon entering the room, I was met with yelling and insults, and as I replied, it angered him more because he could not hear me nor read my lips because of the mask I was wearing. He needed me to get closer to his ear and speak slowly. I could tell that him having to keep telling people this was making him increasingly more upset, and he kept saying he lived a full life and he was ready to go. What I learned is I feel I grew and learned a lot while caring for this patient. Because lengthy conversations were not an option, I had to communicate in other ways with this patient to bring him comfort. He seemed to like when I did the little things, such as giving him a heated blanket and tucking him in and wiping his mouth after he was done drinking. I seemed to be the only person who would answer his call light and enter the room. Yet, people saw him as a difficult patient, and they did not like when he would yell and insult them. Yet I knew that he was not a mean person, but he was just scared and trying to accept a new way of life. And through this experience, I believe I grew in my nonverbal communication skills. Because the little things I would do here and there, I was able to gain some of his trust. And I was also able to communicate in a concise manner. He did not like when we had lengthy conversations, so I was able to convey what I was doing in little to few words. This experience will help me address my public issue of human trafficking because it's important to communicate with them verbally and nonverbally. Providing empathy to this patient is vital, and to focus on communicating with the patient that is in a way that is tailored to their needs. I also want to continue giving report so I communicate important information effectively. The time I was a change agent. So one of the most significant experiences I went through at Madonna was handling a patient with difficult emotions. We had a new patient who was admitted from the Nebraska Medical Center. He was in his 40s and he was dealing with continual strokes with an unknown cause. He was mostly paralyzed and had difficulty speaking, yet was completely aware of everything that was going on. This was immensely difficult on him because he was alone and scared. This was my first experience where caring compassion was the primary need of the patient. In a time like today, in a world of social distancing and COVID, one must be a change agent and implement a need to eliminate feelings of isolation and fear. I typically demonstrate care in a verbal way, yet this patient needed more than what my words could give him. This patient was scared, in pain, and embarrassed. Doctors can scare some people when they explain things in doctor words and not patient words. The doctor came in to talk to the patient about DNR and DNI, and when we re entered the room, the patient immediately started crying. He was scared because he did not understand this concept and thought he was going to die. We explained that we asked this for everyone when they first come in, and we explained what his choices were, and he thanked us. I learned this experience was extremely impactful on me, not only as a learning opportunity, but as a person. Seeing a person in their most vulnerable state made me reflect on why my decision to become a nurse and it helped me solidify that decision. This patient made me more caring and empathetic. I hope in the future I can continue to provide patient care that is not only competent, but empathetic and caring as well. I hope to aid in the way doctors talk to the patients and make sure that they explain things in a way that the patient is able to understand, which will aid in decreasing worry and fears in a patient with their most vulnerable state. I also aim to make their most vulnerable state as modest as I can. It is okay to display emotions through these experiences, but I learned how to express them untraditionally. During a sad moment, I would typically cry, but knowing that this would not help the patient, I displayed these emotions by making sure he was taken care of and had everything that he needed. Overall, this experience was extremely impactful and changed me for the better. So, to address my public health issue of human trafficking through this change agent and experience, the characteristics of their change agent are both culturally competent and address change. To promote change, I aim to handle the way we handle patients during their most vulnerable time. It is important to be there for them, but also be strong. It is natural to have emotions when dealing with such a sad case, yet you can display those emotions in untraditional ways instead of crying. Being there for the patient, listening to their story if they're willing to share, and not pushing them is essential for caring for them. Anticipating questions and providing answers can help alleviate the stress that accompanies the hospital. It is also important to help change the intimidation factor that some doctors can unknowingly possess. Ensuring that you communicate with them and with the patient to ensure that what was said was understood is extremely vital for help. What happened? Through my clinical journey, I've had many experiences where I've noticed areas where change could be made. One clinical experience that I seem to always reflect back on was when I cared for a patient who recently had the stroke that caused left-sided paralysis. Once getting on the floor, I was warned that he was unpleasant, consistently yelled and screamed, and refused to take any and all medications. I was asked if I wanted to care for a different patient, one that wanted me around. I said no, I'll stick with this patient. In the future, I would not be able to switch patients. As I cared for this patient, I was met with screams and insults while also being told I was trying to kill him. Nurses avoided his room, and I seemed to be the only one answering his call lights. This experience taught me how to be a change agent. I was able to analyze the situation and realize that no one wanted to provide care to this difficult and verbally combative patient. Everyone deserves the same quality of care, no matter who they are and how they act. It is important to understand that the patient may have been acting this way because he was scared and his life has changed forever. The patient makes statements like, "I am useless, and just let me die." Avoiding him and leaving him alone would make this fear worsen. Through this clinical experience, Through clinical experiences like this one and others, I have learned that many have biases towards certain people, and this affects their care. Another example is when I was caring for a dying chronic substance abuse user, and I observed the staff saying, "He's just an addict, and he did this to himself." I learned that I want to change this mentality in medicine. None of us live perfectly healthy lives and do things that can potentially damage our health every day. Like the patient in this experience, he had a stroke because he refused his blood thinner after his heart procedure, causing him to have a blood clot that traveled to his brain. Just because his actions led to this does not mean the quality of care should differ. For this experience, I learned that I want to change the way people see patients and their histories. This experience will help me address my public issue of human trafficking because when seeing a patient, it's important to not judge that patient because you don't know their past. Many sex trafficking victims come to the hospital with chronic UTIs and STDs. You may label this patient as promiscuous, but in reality, they're being trafficked against their will. It's important to take in the whole picture of the patient. My time at Nebraska Methodist College in the Accelerator program has given me the tools and resources I need to develop my practice so that I can become a change agent, reflective individual, and effective communicator. Through my time here, I've grown tremendously into a nurse who can lead by example and make effective change in the workplace. In the future, I will communicate in a concise manner. I will incorporate compassion for every patient, regardless of their situation, and I will commit to continuing education. I will always use the knowledge I've gained in this program, and I'm truly grateful. Thank you so much.